Okay guys, my name is Pedro. I am a registered nurse studying to be a nurse anesthetist. I am going to do a pre-op assessment on one of my patients who is actually getting checked in right now. I just wanted to kind of go over what I'm going to be doing. So today I'm going to do a pre-op assessment of the neurological system, cardiac, vascular, and thoracic. Just a couple tips when you do a pre-op assessment on any patient. Make sure you have your pre-op assessment form. Having your pre-op assessment form not only provides structure to your assessment, but it also decreases the chances of you missing something that could be detrimental when you're actually in the operating room. So let's see how it goes. Okay guys, so this is the moment. We have the patient in the room. We're gonna do the pre-op assessment. So just quick little tips. Number one, have your assessment form in hand. Number two, we have a very short period of time to build that patient-provider rapport. We want to establish that rapport because we want to establish confidence in the patients. We're the ones that are going to administer anesthesia. So we're basically going to have their lives in our hands. So let's get started. Hi, and how are you?
Hi, how are you?
Good. My name is Pedro. I'm a registered nurse studying anesthesia. I'm going to do your pre-op assessment today. I'm going to ask you a couple questions. Can you tell me your full name?
Alan Rubio,
Okay. What's your date of birth?
October 3rd, 88.
Perfect. And do you know where we are?
Yes, Miami, Florida.
Okay. Do you know the hospital?
Yes, Jackson Memorial.
Perfect. Okay. So just by talking to the patient, we're going to get that brief neuro assessment. We know that he's oriented ×3. And we're just going to kind of continue having a conversation. So, Alan, what are you going to have done today?
Surgery?
Okay. Perfect. So, question. I'm going to ask you just a quick little history about yourself. Can you tell me, do you have any cardiac history? Any shortness of breath for the last couple of weeks?
No history.
No temperature? Are you able to go up a flight of steps without
No
getting
temperature, and yes, I can go up a flight of steps.
Okay, that's great. Let's see. Perfect. So what I'm gonna do is I'm gonna ask you a series of questions, and I'm gonna do a couple of assessments. I'm gonna listen to your hearts and different systems, just to see how you're doing before surgery. Is that okay with you?
Yeah.
Perfect. So what we're gonna do is I like to work myself from the top to the bottom, head to toe. So we're gonna start with our neurological status. Okay, Alan. So to start off, I'm gonna assess your cranial nerves. Okay. So the first cranial nerves I'm gonna assess is your cranial nerves 3, 4, and 6.
Okay.
So I'm gonna need you to follow what I have right in front of you, without moving your head, just moving your eyes. Can you follow it up, down, to the middle, to the side, spin it? Okay, perfect. So we're gonna move on to cranial nerve number 5. So for cranial nerve number 5, I'm gonna have you clench your jaw, and if you can move it from side to side. Perfect. Okay. So now with your mouth closed, with your eyes closed, I'm gonna kind of tap you on the side. You're gonna tell me if it's a sharp tap or if it's a soft tip.
Sharp.
Okay?
Sharp.
What about this one?
Soft.
Perfect. So now we're gonna move forward to your cranial nerve number 7. So this is gonna be your facial nerves. I'm gonna have you smile, frown. Perfect. And can you whistle for me? Awesome. Okay, so moving forward, we're going to do your acoustic nerve, which is nerve number 8. Okay? So I'm going to have your eyes closed. Tell me what you hear. If you hear left or right.
Right. Right. Right.
Okay?
Left. Left. Left.
Perfect. And you want to do that about 3 feet away from the patient to make sure they hear it. Okay, so moving forward, we're going to check your gag reflex, which is nerves number 9 and 10. So I'm putting this tongue depressor down your throat. Let's see. Okay, so he definitely has a gag reflex. We're going to move on to cranial nerve number 11. So this nerve is your spinal accessory nerve. We're going to check if he could put against resistance, he could shrug his shoulders. Perfect. Shrug the other one. Okay, so you're doing great, Alan. So the last one, I'm going to have your cranial nerve number 12. If you could stake out your tongue, can you move it up, down, and to the sides? Perfect. Okay. So So now we're going to go into our sensory function. In our sensory function, we want to check that all extremities, including bilateral lowers. So what we're going to do is, do you feel this?
Yes.
Close your eyes. Tell me if I'm pinching.
Pinching. Yes. Yes.
Perfect. Same thing.
Yes. Yes.
Awesome. So let me see your leg. You feel it? Bottom?
Yes.
Okay. So that completes our neurological assessment. We're going to move forward to the next. Okay guys, so to continue our assessments, we're going to combine our cardiac and our peripheral vascular systems. It's something that you could kind of combine together. It's relatable. So let's get started. Hey Alan, how's it going again? Alan, I'm going to do your cardiac history. So I'm going to ask you a couple questions, okay?
Okay.
Have you ever had any heart attack, any MI, or history of carotid artery disease,
No.
coronary artery disease?
No.
No? Okay. Diabetes, do you smoke?
No, I'm not a smoker.
Okay. Perfect. So what I'm going to do is first I'm going to inspect, I'm going to palpate you in certain areas, and then I'm going to listen to you as
Okay.
well. So my first inspection is going to be your jugular veins. So I'm going to have you move your head to the right, to the left. Okay, perfect. So you just want to see for pulsating. Second, I'm going to see your chest. So I'm checking the chest that has equal rise. There's no abnormal growth. That it's symmetric. We're also going to inspect the pericardium. Okay. Then we're going to move into palpating. So palpating, we're going to do the carotid arteries. We want to do them one at a time. The patient has a risk to pass out if you do both. So first one. Perfect. Let's look the other way. All right, you did great. We're going to check your apical pulse, which is going to be your macrobigular line, fifth intercostal space, which is going to be around here. Okay, that's perfect. So next we're going to do your hepatojugular reflex. To do this, what we're going to do is we're going to have the patient look to the left. We're going to put some pressure around the liver area. We're going to see that jugular vein fill up. And when we release, we want to see it return to normal. If it doesn't return to normal, it might indicate some type of right-hearted heart failure, right-sided heart failure. Okay, so let's start to auscultate. So to auscultate, what I'm going to do is I'm going to listen to your valve, which is going to be your second intercostal space to the right of the patient's sternum. Your pulmonic valve, which is also your second intercostal space to the left of the patient, sternum. And this is where we're going to listen to for the S2 sounds, the best. We're going to move down to your tricuspid, which is going to be your fourth intercostal space. And then lastly, we're going to go into your mitral valve, which is going to be your intraclavicular line, fifth intercostal space. And this is also where you're going to hear your S1 the best. Kellen, you're doing good. I'm going to switch over my stethoscope to the bell section. Just going to listen for any abnormal heart sounds, any murmurs that I could maybe pick up. Okay, and you definitely do not have any, which is great. Okay, so we're gonna go forward and we're gonna do our peripheral vascular section as well. For this section, we're just gonna look at the patient. We're gonna examine the patient's extremities. We wanna look for color, warmth, any edema, for tenting, on both extremities, the patient's facial hair, see the hair, see both arms. We're also gonna check both legs. So in the legs, we want to check the calves. We want to check the calves, we want to check the size, make sure it's not hard. Again, temperature, color, skin turgor. We want to do the Holman sign. So Alan, if you could flex your leg up. Does it hurt your calf?
No.
Okay, perfect. We're going to do the same for your other leg. Flex up. Okay, so that's perfect. We want to check the cap refills. So try to borrow a finger. Make sure it's less than 3 seconds. Perfect, less than 3 seconds. We're gonna do the same in this case my patient has his shoes, so we'll ask the patient to take off the shoes and we'll do that assessment. So we wanna check for swelling. We wanna grade the pulses, so we wanna check your pulse. Perfect, so it's a +2 and it's a scale of 0 to 4. We're gonna check your brachial. Same, +2. Perfect. We want to check your pedal pulses as well. In this case, my patient has shoes, so again, we'll have him take them off. So that basically concludes our peripheral vascular section. We're gonna move forward to the thoracic. All right, guys. So for our last section, we're gonna do a thoracic assessment. Okay, Alan. So the first thing I'm gonna do is I'm gonna assess the patient's chest area. So we want to check for symmetry. We want to check that there's no abnormal growth, no pulsation. We want to look for symmetry. So take a deep breath for me. Okay. We're going to look at the sternal notch and the sternal angle as well. Okay. So it's perfect. We're going to move forward, and we are going to do the thoracic expansion. So Alan, I'm going to have you lean forward just quite a bit. I'm going to sit right behind the patient with my arms just like this. I'm going to place him in the lower back around the T10 area. And I'm going to ask the patient to take a deep breath. Alan, can you take a deep breath for me? So as he's taking a deep breath, I'm looking for the range and I'm looking for symmetric rise. So the range is around 2, which is perfect. Thank you, Alan. So now we're going to progress to tactile frembus. I'm going to have the patient sit up straight with the palms of my hands. I'm going to place them right in the back, and I'm going to have the patient say 99.
99, 99, 99, 99.
And we're kind of feeling even vibrations all throughout, going down. Next, we're going to do some percussion. So we want to use our middle finger, place it on the patient, and we're kind of listening for that resonance. Okay. Okay, so now we're going to move forward and we're going to actually auscultate with the diaphragm part of our stethoscope. We're going to go in a ladder position, starting at the top. For each section of the lungs, we're going to take a full breath. Okay, Alan, if you could take a deep breath. Perfect. Okay. Okay. So he has clear lung sounds all throughout. We're going to do the same thing anteriorly. So we're going to have the patient sit back a little bit. Okay, deep breath. Deep breath. Deep breath. Okay, and clear breaths all throughout. So for the vocal resonance part of the exam, it basically includes 3 sections. The first one is the bronchophony. We're going to have the patient, I'm going to auscultate the back of the patient as the patient says 99. Okay?
99, 99, 99, 99, 99, 99.
And what you want to hear is kind of muffled sounds, so that's normal. Then we're going to go to the echophony. And then we're also going to auscultate the posterior section. And the patient is going to say E.
E, 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 E.
Okay, and then the last one is the whisper pectology. And then here we're going to have the patient whisper 1, 2, and 3. And we shouldn't be able to hear this. And that concludes our entire assessment. Okay guys, thank you for watching our video today. Keep in mind, a pre-anesthesia assessment is crucial when administering anesthesia to any patient. Make sure that your pre-assessment is very thorough. You want to include your Malin patty, your ASA, and so on. Again, I hope you enjoyed it.